Hi, I'm Dr. Rohit Madhurkar. Lump in the neck is mostly due to thyroid, and this is because the thyroid gland enlarges or there is a lump in the thyroid gland or a nodule which we call nodule in the thyroid gland, and this is very common in female. That's why we are saying female with the lump in the neck is this thyroid nodule. Most of the time, most common thing minute we see. And how do we identify that this is thyroid nodule? When you swallow, and if the nodule is moving with that, then it is most commonly the thyroid nodule which is there. And these thyroid nodules are of different variety. There can be a cyst and on one end, and in between they can be just solid nodules which are there. On the other end they can be malignant. These nodules can be functional or non-functional nodules which are secreting some hormones. As we know, thyroid is a very important organ in our body. Many of your friends, family members may be suffering from thyroid, hyperthyroid or hypothyroid, and they are taking medications for this. And this nodule per se may or may not be involved in this thyroid disease that they are having. But thyroid nodule is a morphological, means an anatomical, a structural abnormality within the thyroid gland, which is like a lump, like how we get some lump in the skin or a boil on the face, that kind. It is a nodule which is appearing in the thyroid gland. Most of the time when patient come with thyroid nodule, it is usually first most commonest thing is aesthetically. They can see the nodule on their neck. Somebody notice swelling when they are talking in the neck. So that is thyroid nodule. Many a times it may be sometimes in the center. People confuse it to Adam's apple in men and kind of not realize it is thyroid nodule. But many times when you see a nodule on the neck, that is the thyroid nodule, and they come with a clinical representation of a small swelling in the neck. Then comes other symptoms. As the thyroid nodules gets bigger and bigger, these thyroid nodules start pressing the structures in and around it. First, then comes change in voice. There is huskiness in voice. The patient's voice will be like that kind of little husky. The voice gets a little husky, and it is very well understood by somebody who has met the person 1-2 years back, and now they feel the voice is a little husky. But this change is very slow. Over time it becomes husky. So whenever I see patients with big nodules, they usually have a husky voice, and they always say that my voice has been like this and not much different. They feel that from childhood it's just been progressing to some adult sound, that kind of a format. Then comes other compressive symptoms, that is difficulty in breathing. We have the windpipe here, so it compresses the windpipe or pushes the windpipe, and along with that we have the food pipe, esophagus. So this esophagus, when you're swallowing food, difficulty in swallowing of food. When you swallow the food does not go down very smoothly. These are the other symptoms that we notice, and these are the most commonest ones that we come across when we see patient with thyroid nodule.